Hello and welcome to part 4 of spinal anatomy. We're going to discuss the atlas and the axis in more detail in this lecture. Okay, so the atlas is the first cervical vertebrae, and this name is taken from a Greek god who held the world on his shoulders. So in this case, think of the world as our skull. The atlas holds or articulates with the base of our skull. C1 is the least typical cervical vertebrae. It really has unique characteristics that none of the other cervical vertebrae have. In fact, C1 has no body. It has a thick arch of bone instead called the anterior arch. So let's look at that. So this right here, instead of a body, it's an anterior arch on C1. Okay? The anterior arch has a small anterior tubercle or bump, which you can see here, kind of anterior tubercle. The dens or the odontoid process is part of the second cervical vertebrae. So this right here is part of C2, which we'll look at more in a minute. But you can see it when you look at C1 from the top down, which is what this diagram depicts. We're looking from the top down, as though we've removed the skull. So you can see part of C2 pointing up through C1. You don't need to write this part down, but the dens is held in place by the transverse atlantal ligament, which is what you see here, and we don't need to know that. C1 does not have two lamina and a spinous process like a typical vertebrae, but rather C1 has a posterior arch that generally has a small posterior tubercle at the midline. So again, there's no real spinous process. It is a posterior arch with a posterior tubercle. Now this is part of C2 that you're seeing, so this is not part of C1. The right and left superior articular processes of C1 have a large depressed surface called a superior facet. And remember, facet is just a surface for articulations. These superior facets, which you can see here and here, articulate with the base of the skull. Okay, and I've included a diagram here in the upper corner. This is not C1. Remember, C1 doesn't have a body. This is just kind of a typical cervical vertebrae, and I included it so that you could reference, again, what is a superior articular process and what is an inferior articular process. So what we're talking about is this surface here corresponds to this surface on a typical vertebrae, okay? So this articulation between C1 and the base of the skull, or the occipital condyles of the skull, is called the occipito-atlantal joint. And you can kind of see it alludes to that here. The transverse processes of C1 are smaller, but they still contain those transverse foramina that we discussed in part 3. And again, transverse foramina are distinctive of cervical vertebrae. Thoracic and lumbar vertebrae do not have these little holes in their transverse processes. Remember articular pillars? So let's reference a diagram. The articular pillar is this column of bone in between the articular processes. Remember on C1, that's called a lateral mass, because the lateral mass of C1 supports the weight of the head, and it actually assists in the rotation of the head, and these portions are the most bulky and solid part of C1. Okay, so remember, in the rest of the cervical spine, this is called an articular pillar, but in C1, because it's holding or supporting the skull, it's called a lateral mass. Okay, next, let's talk about the axis. So looking at C2, we call C2 the axis. It's important to first begin with the dens. So you can see here is C1 on top of C2. So let's look at C2 by itself, and we're going to start with the dens. The dens is also called the odontoid process. You'll hear that term interchanged pretty frequently. The dens is a cone-shaped process that projects up from the superior surface of the body of C2. You can see that here. So here is the body of C2, and then that dens just kind of sticks up, and remember, it sticks up through C1. Interestingly, and you don't need to write this down, but in the embryo, the dens is actually the body of C1, but it fuses to C2 during development. And as a result, it's considered part of C2 in mature skeletons. And remember, C1 doesn't have a body. Rotation of the head occurs between C1 and C2, and the dens acts as a pivot point. Okay, thus the name the axis. The superior facets of the superior articular processes that articulate with the skull also assist in rotation of the head. Okay, and remember we're talking about this. It is possible to fracture the dens with severe stress from such actions as forced flexion or hyperextension, and that would be what we know as whiplash. Any fracture of the vertebral column at this level is serious because it could result in paralysis or even death. The inferior articular process of C2, which articulates with C3, lie inferior to the lamina. So let's look at that. So again, here's the lamina of C2. Here's the spinous process. So the inferior articular processes would be underneath the lamina and again articulate with C3. So below and lateral to the superior articular processes, which are here. So below and lateral are those transverse processes, again with their transverse foramina. And of course, we already pointed out the spinous process has a bifid tip and extends posteriorly. Okay, so please be familiar with the characteristics of the atlas and the axis, including their differences. Okay? Okay, we're going to finish part 4 by looking at this AP open mouth projection. Demonstrating the relationship between C1 and the base of the skull and the relationship between C1 and C2 is really important because remember, any injury this high in the spinal canal can result in paralysis or even death. This image, again, is called an AP open mouth projection. And we do this x-ray to visualize C1 and C2, and you'll actually check off on this projection in lab. So a couple things to note. We really don't see the anterior arch of C1. Remember, C1 doesn't have a body, it just has an anterior arch. We really don't see that here because it's in front of the dens and it's a pretty thin piece of bone. The dens is much larger and denser in comparison. So let's point that out. You can very faintly see the transverse process of C1, and you can see this little piece of bone right here. It's really faint, but that is the anterior arch of C1 in front of the dens. So A is pointing to the dens. This line right here, just for your reference, is the base of the skull. And we'll point out all these parts in just a minute. So when we're performing this x-ray, we have the patient open the mouth and we shoot through the open mouth. And what are we looking for? What makes a good image? Well, you want to see the zygapophyseal joints. So remember back to part 3 that in a lateral C-spine, you will visualize these zygapophyseal joints. The exception is the zygapophyseal joints in between C1 and C2. You will only see those in an AP open mouth. And that is, let me show you, these spaces right here are the zygapophyseal joints between C1 and C2. Kind of cool. They're also called the atlantoaxial joints because they're the joint between the axis and the atlas. Those joints should look symmetrical. So that's the first thing we look for. We also look for the relationship between the dens and C1 to be symmetrical. Okay, so C1 should look nice and centered around C1, or in C1 rather. The tricky part is, for us, is that injury or improper positioning can make these areas look asymmetrical. So for example, if the skull is slightly rotated or if there's any tilt, that can alter the symmetry of these joints and of the dens. That could imitate an injury. So my point is, you have to be really precise and use accurate positioning for this region. It's so important. So really take your time and do a nice job. So let's label this radiograph really quickly here before we conclude. So A, of course, as we talked about, is the dens of C2, poking up through C1. B is pointing to the left transverse process of C1. C is pointing to that pillar or lateral mass of C1. D is the inferior articular surface of C1. Remember, the articular surfaces meet to make the zygapophyseal joints. So D is the inferior articular surface of C1 joining the superior articular surface of C2, and that forms the zygapophyseal joint. Okay, E then would be the left zygapophyseal joint. F is the body of C2, and G is the right superior articular surface of C2, meeting the right inferior articular surface of C1 to form the right zygapophyseal joint. Okay, again, I know this is a lot of information. We will practice with all of this in lab, and I promise you'll feel better. We're going to conclude part 4 here. We'll pick up with thoracic anatomy in part 5.